Hi, my name is Dr. Emily Jamea. I am a certified sex therapist and a licensed marriage and family therapist, and of course, a proud ambassador to Healthy Women. I'm doing a takeover today in honor of Women's Health Week, and I'm here to talk to you a little bit about sex during midlife because I hear that's something that you guys have a lot of questions about, and it's something that clients come to see me in my office to seek guidance on all of the time. So I want to begin by saying that noticing a change in your sexuality during midlife is extremely common, so you are not alone. I think that is first and foremost one of the most important things to remember. A lot of women struggle with adapting to the changes that happen in their sexuality as they go through menopause and beyond. But I have some really exciting news for you. The latest research into what constitutes really optimal sexual experiences is finding that for a lot of people, sex can get better with time. So you just have to know what tools will help that happen for you and really adopt a really positive mindset so that you can adapt to some of the changes as opposed to resist them. So I'm going to give you some insight today about what kinds of changes can occur, and then I'm going to talk to you a little bit about how you can learn to cope with them so that you can maintain a really healthy and very satisfying sex life. So as women go through menopause, there are a lot of hormonal changes that happen. You're going to primarily notice a drop in estrogen. That is the biggest hormone that changes during menopause. Estrogen is responsible for vaginal lubrication, and it's responsible also for keeping the tissues in the vagina elastic and healthy. So when estrogen levels go down, what a lot of women notice is that they have an increase in vaginal dryness. And so we're going to talk a little bit about how to cope with that. But I think that's interesting because what a lot of women complain about is they feel like they're not really in the mood for sex. So we're talking about the effect of estrogen on vaginal lubrication, which is more in the arousal realm, whereas what a lot of women are complaining about is low sexual desire. So I want to first explain to you how those two are linked. So for women more so than men, desire and arousal tend to happen hand in hand. In other words, a lot of women don't really feel very in the mood for sex until there is a little bit of physical and emotional or psychological arousal. So with estrogen levels going down and the physical arousal becoming a bit more challenging, women may misconstrue that to think that they're just not in the mood. The other thing that can happen is when estrogen levels go down and the vagina becomes a little bit more dry, if you're not adding some kind of personal lubricant or something like that to help, sex can become painful. And guess what? If something hurts, of course you're not going to want to do it. So it's not for most women that sexual desire is the primary result of the decline in estrogen, but it's more that the decline in estrogen changes the way the vagina functions, and that can cause a little bit of difficulty for some women in becoming aroused, or in some cases cause sex to be painful, which can cause low sexual desire as a side effect. So the desire is more of a secondary issue. I think that's really important to remember because there's a lot more to the pie than our ability to become lubricated as it affects our sexual desire. Desire is complex, especially for women. It is multifactorial. So it is just as important that you have a really healthy relationship, that you feel good about yourself, that you feel good in your body, that you have a healthy self-esteem. All of those will help your sexual desire stay at a higher level. So let's talk a little bit now about what you can do to combat some of the vaginal dryness issues that can come as a result of menopause. So the first thing is lube. It's important just to get on board with lube. Become friends with lube. There are all kinds of personal lubricants, and I'm going to talk a little bit about some of the most popular ones just so that you have some information before you begin your search. So there are water-based lubricants. A lot of women say that these feel the most like their natural lubricant, The problem with water-based lubricants is that water evaporates. So a lot of women will find that they have to apply kind of a lot or keep reapplying to help them stay lubricated. A lot of women don't have a problem with that, but that's just one of the downsides of water-based lubricants. Another kind of lubricant are silicone lubricants. I usually recommend silicone lubricants, and the reason for that is because they can almost act like a vaginal moisturizer, trapping moisture into the skin, just like if you were to apply lotion to your legs. So those can be great because you don't have to use as much of them, and they tend to last a little bit longer. Now, remember, if you're using a silicone-based lubricant, that you don't want to mix that with any sex toys that are also made of silicone, for the most part. There's a couple newer ones on the market that can be okay, but you just want to do your research before making that choice. Another really popular one are things like coconut oils or petroleum jellies. Some women prefer the feel and consistency of those kinds of lubricants. Just remember that for the most part, those aren't safe to use with condoms. So, all lubricants have their pros and cons. It really comes down to personal preference. There is no right or wrong. A lot of times you can buy kind of a little sample size of different ones to try, and I always recommend women do that before committing to the lube that you're going to keep on hand at your bedside table. But if you remember what I said when I first started this video, and that is, it's all about your mindset. So it's how willing you are to adapt to some of the changes that occur. I think that women struggle when we try to resist the changes that are happening, or allow ourselves to get too frustrated by maybe having to take this extra step. And so it's just really important, I think, to keep an open mind and hopefully have a supportive partner who's willing to work with you as you go through the process. The other issue that I mentioned that can happen is because of the vaginal dryness, you might notice that sex becomes uncomfortable. And for women who are not having regular intercourse, over time, if you're not inserting anything into the vagina, with the drop in estrogen, the vagina can actually atrophy a little bit, meaning that the vaginal canal itself can shorten. And then let's say down the line, you decide you have a new sexual partner, or you're having intercourse again. That can be a little bit harder to overcome. So I want to talk a little bit about, for women who aren't having regular intercourse or who don't have a regular sex partner, what you can do to keep the vagina healthy and elastic even as you're going through or after having gone through menopause. What I usually recommend women do is get a set of graduated vaginal dilators. These are little dilators that, kind of the shape of a tampon. They start from very small and then they become larger, that you insert into the vagina. And you just start with the one that feels the most comfortable, and as you become more and more comfortable, you can go up in size. That will help sort of strengthen that mind-body connection again and start to bring blood flow and oxygen to those tissues to help keep them healthy. The other thing you can do is to get a small vibrating wand, and you can insert that into the vagina. I usually recommend women do this a couple of times a week. It's not a huge commitment. And you just insert it a little bit of ways into the vagina. You don't have to go very deep. Turn it on and just sort of kind of move it around the vagina so that you're hitting all those pelvic floor muscles. What that does is the vibrations help bring, again, that blood flow and oxygen to the tissues in the vagina, which will go a long way to keep it healthy. The other thing to remember, and this is for all women, no matter what stage of life you're in, is to do your Kegels. So just as, physical fitness and exercise is important as you age, if you're postmenopausal, you probably hear about this a lot, to keep your muscles strong to prevent osteoporosis. Well, the pelvic floor muscles is a huge group of muscles, and they're often neglected. So what I recommend for women, no matter what stage of life you're in, is to do about 3 sets of 10 of pelvic floor contractions and relaxations. A lot of women don't do these properly, so I'm going to just go over that very briefly. A Kegel exercise essentially feels like you're stopping the flow of urine midstream. So you just want to very slowly draw up the pelvic floor, hold for 3 to 5 seconds and then relax. That's one. You don't want to do these too quickly because that actually exercises a different muscle fiber. It's called a quick flick. What we want to focus on is that slow draw and relax. And you can do, 10 to 30 of these a few times a week, and then you've done your pelvic floor Kegel exercises. So I hope that helps. I just want to reiterate though how important it is for women to pay attention to what's happening in your environment, pay attention to what's happening in your relationship, pay attention to what's happening just with your overall self-esteem. All of these can go a long way to helping you maintain a really high level of desire. Remember, if it was something as simple as elevating your hormones, the pharmaceutical companies would have been on top of that a long time ago. But the truth is, sexual desire is far more complex. There's a lot you can do to help navigate the changes as you go through menopause. And again, remember what the research is showing us is that sex for a lot of women gets better as we age. So I hope this gives you something to look forward to and some insight. Be sure to follow me at Dr. Emily Jamea. I provide weekly tips, so you'll always get one for you, one for your relationship, and one for your sex life. Thank you for letting me take over. Bye.